come to us for a nose job surgery. So you can see his from the front profile that he has a very broad nose. It's a thick skin South Indian nose. It's a difficult kind of a rhinoplasty. So this is going to be a reduction rhinoplasty. He's seeking reduction in the overall size of the nose. So these are his different views. So this is the basal view. You can see that he has a very broad ala base. So, and also you can see in the side profile that he has got a very thick skin in the tip, this region. So we are planning to do defattening there. We are going to give him some tip support. We are going to converge all the lower lateral cartilages to give him a much more refined kind of a tip. He is seeking reduction at this level as well. So he has issues wearing sunglasses or any eyeglasses which is not fitting his nose. This is very broad for him. So we're planning to shave the nasal bones there. We're planning to do the osteotomies, trying to get all the nasal bones as much closer as possible for this patient. So this is going to be a septorhinoplasty, and also we are planning to give him a bridge which is going to be straight. So this we are planning using a rib cartilage that will be used to give him the rim support as well. You can see there's a collapse of alar rims. The alar cartilages are very weak. So using the rib cartilage, we are going to give him a rim support, tip support, and also dorsum as well as radix augmentation for this patient. So this will be done under general anesthesia, and we'll be shifting now patient to the operation theatre. Front profile photograph of this patient. So we have different profiles now. So this is side profile of the same patient, and this is the basal view. So let's ask him whatever changes that he is seeking, so that before surgery everything is clear from both the ends. ಹೇಳಿ ಏನೇನು ಚೇಂಜಸ್ ನೀವು ಎಕ್ಸ್ಪೆಕ್ಟ್ ಮಾಡ್ತಾ ಇದ್ದೀರಾ?
ಸೊ ಇದರಲ್ಲಿ ಬಂದ್ಬಿಟ್ಟು ನಮಗೆ ಟೈಲರಿಂಗ್ ವರ್ಕ್ ಮಾಡ್ತೀವಿ, ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ಹೆಡ್ಡೇಕ್ ಇರೋದ್ರಿಂದ ನಾವು ಸ್ಪೆಕ್ಸ್ ಪರ್ಚೇಸ್ ಮಾಡೋಕ್ಕಂತ ಹೋಗಿ ಶಾಪ್ಗೆ. ಬಟ್ ಅಲ್ಲಿ ನಮಗೆ ಇಲ್ಲಿ ಜಾಸ್ತಿ ದಪ್ಪ ಇರೋದ್ರೆ ನಮ್ಮ ಸೈಜ್ ಯಾವುದು ಸಿಗ್ತಾ ಇಲ್ಲ ಎಕ್ಸಾಕ್ಟಾಗಿ. ಮತ್ತು ಇನ್ನೊಂದು ಅವ್ರು ಮತ್ತೆ ಬೇರೆ ನಮಗೆ ಸ್ಪೆಟ್ ತಗೊಳಕ್ಕೆ ಹೋದ್ರು ಅದೇ ಕರೆಕ್ಟಾಗಿ ಕೂರ್ತಲ್ಲಿ ಜಾಸ್ತಿ ಗ್ಯಾಪ್ ಬರ್ತಾ ಇದೆ ಸ್ಪೆಟ್ಸ್ ಹಾಕೊಂಡ್ರೆ. ಮತ್ತು ಇಲ್ಲಿ ಈ ಕಡೆ ಸ್ವಲ್ಪ ಯಾವುದೇ ಫೋಟೋಶಾಪ್ ತೊಗೊಂಡ್ರು ಸಮೇತ ಇಲ್ಲಿ ಒಂಥರ ಇದ್ರ ಕಾಣುತ್ತೆ, ಶೇಪ್ ನೀಟಾಗಿಲ್ಲ. ಮತ್ತು ಇಲ್ಲಿ ಜಾಸ್ತಿ ದಪ್ಪ ಇದೆ, ಮತ್ತು ಈ ಕಡೆ ಜಾಸ್ತಿ ಬ್ರಾಡ್ ಆಗಿದೆ, ಮತ್ತು ಈ ಕಡೆ ಸ್ವಲ್ಪ ತಗ್ಗು ಟೈಪ್ ಇದೆ.
ಓಕೆ,
ಯಾವ ಫೋಟೋಶೂಟಿಗೂ ಸ್ವಲ್ಪ ಇದಾಗ್ತಿಲ್ಲ ಅಂತ.
ರೈಟ್. Okay, so he is seeking a reduction rhinoplasty as we discussed. So, and also in the side profile, there's a slight depression at the dorsum. So this also will be corrected in the same surgery. Thank you. So we are in the middle of a rhinoplasty. We are harvesting the rib cartilage from the patient's 7th cartilage. So if you come closer, I can show you we are harvesting the rib. We've already done the cuts. So we're going to remove the rib cartilage now. So this will be used for the augmentation of the nose. So we are now closing the rib cartilage, the rib area. It's important to close it in layers to avoid that space formation or to avoid some collection there. So once we complete the rib, we are going to start the rhinoplasty. Before and after side profile after rhinoplasty, you can see before surgery he had a very flat radix, and there was a depression in the dorsum, and also very bulbous tip which was unsupported as well. And this is immediately after. We increase the projection, increase the height, and also we have given a tip graft for the support. So this is before and after basal view. So before surgery you can see there was a collapse of tip, there's a collapse of the alar cartilages, very bulbous and boxy tip before surgery. We have got a good projection now. We have given a tip graft, it's a flexion graft, and also worked on his alar rim. So this is before and after. So this is just 6 hours after surgery. The patient is already fine. He's doing well. He's talking, he's walking, and everything is good. So this is about the beauty of anesthesia. So the patient is now taking oral food and everything. So he started with a regular diet, and we will come up with the follow-up videos tomorrow morning. Thank you. This is rhinoplasty surgery with rib grafting. ಹೇಗಿದ್ದೀರಾ? ನೋವು ಹೆಂಗಿದೆ ಮೂಗಲ್ಲಿ?
ಸೊ ಈಗ ಸದ್ಯಕ್ಕೆ ನೆನ್ನೆ ಇತ್ತು ಸ್ವಲ್ಪ ಬೆಟರ್ ಇದೆ.
ನೆನ್ನೆಗಿಂತ ಬೆಟರ್
ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ಇತ್ತು ಇಲ್ಲಿ ಈ ಕಡೆ.
ಹಾಂ
ಈಗ ಸ್ವಲ್ಪ ಇದೆ.
Okay. Usually the first day after surgery, first 24 hours, they will have discomfort and little bit of pain. I would say it's rather more discomfort than pain, because we will give them all the medicines for the pain. The patient will have slight discomfort, especially in the rib when they try to get up and walk. Otherwise, on day 2 it will be gradually improved, like more than 50 to 60%, and day 3 they will be absolutely fine. They will have no pain in the nose, no pain in the rib. And most important thing is the diet in rhinoplasty. Following rhinoplasty, they will have regular diet. ಊಟ ತಿಂಡಿ ಏನೇನು ಮಾಡ್ತಾ ಇದ್ದೀರಾ?
ಸೊ ಊಟ ತಿಂಡಿ ಎಲ್ಲ ಇದು ಮಾಡ್ತೀವಿ, ಹೆಲ್ಪ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ.
ಹಾಂ, ಎಲ್ಲ
ಇಲ್ಲಿ ಸ್ಟಾಫ್ ಆಗಿರ್ಬೋದು, ಮತ್ತೆ ಕೆಳಗಡೆ ಸೆಕ್ಯೂರಿಟಿ ಅವರ್ಸ್ ತುಪ್ಕೊಡ್ತಾ ಇದ್ದಾರೆ.
ಓಕೆ. ಊಟ ತಿಂಡಿ ಎಲ್ಲ ನಾರ್ಮಲ್ ಆಗಿ ಮುಂಚೆ ಏನು ಊಟ ಮಾಡ್ತಾ ಇದ್ರಿ?
ಚಪಾತಿ
ಅದೆಲ್ಲ ಊಟ ಮಾಡ್ತೀವಿ. ಸೊ ಈಸ್ ಹ್ಯಾವಿಂಗ್ ಎ ರೆಗ್ಯುಲರ್ ಡಯಟ್. ದಿಸ್ ನೋ ನಥಿಂಗ್ ಲೈಕ್ ಸಾಫ್ಟ್ ಡಯಟ್ ಆರ್ ಲಿಕ್ವಿಡ್ ಡಯಟ್. They're having a normal regular diet like before. And also this patient has come alone all the way from Chitradurga, which is around 250 kilometers from here. So he has come alone, so the hospital staff is taking care of his all diet, food and everything. So we usually take care of all these kind of patients when they come alone, they travel alone. And so today is just day 2. We will come up with the follow-up videos in following days throughout the journey of his in the hospital till the discharge, and we will show you the transformation that he has got. He had got a really boxy tip and very broad nose, and he has underwent a reduction rhinoplasty. So we will come up with the follow-up videos in future. Thank you. 10 days before rhinoplasty, patient having a very broad nose, unsupported tip, bulbous and boxy nasal tip, depressed dorsum and radix. And this is just 10 days after the splint removal. He's got a beautiful dorsum and also very straight and dorsal aesthetic lines. Got a good tip support and projected tip, increased height in the radix, good lip to nose ratio after surgery.